Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now today our topic is about constipation. I have two practitioners. They are actually acupuncturists, and I asked me Raji from India and Shoka. I don't know where you're from, Shoka. Both of you asked me how to use acupressure point or acupuncture to treat constipation. Now, first, we're gonna go through what is constipation and what can cause it and what can you do at home, and then I can show you some acupressure point for constipation. Okay, and based on balanced meridian theory and based on Chinese medicine theory. Okay. Hi, Eric. How are you from Norway? That's great. Thank you for introducing yourself. And yes, everyone, when you come to watch my live video, the first thing you have to do, and I wish you can do that for me, to say hello to me and let me know whether you're an acupuncturist or you one of my patients, or you are just you're not an acupuncturist. You just want to learn some acupressure point here. And yeah, let me know where you're from and give me a thumbs up and send me a love. And more important, if you're on Facebook, please share. Click the share button, share it on your Facebook page, on YouTube, Instagram as well. If you can share, please share. And on YouTube, please, after we finish this, please take the link and share on your social media page. And that would help me to get more people to watch my live video. And that would help me to keep going to present acupuncture and acupressure point for you, right? So let's talk about, I got some material over here. We're going to talk about constipation. So first, we need to know what is a normal bowel motion. The normal bowel motion, well, I would say once a day because we eat every day, right? But some people actually say this from between 1 to 3 times a week, a day, because you eat 3 meals, then you need to pass 3 meals. It is okay if you pass 3 meals, but you need not pass 3 meals. If you go for bowel motion 3 times daily, I think this is okay, as long as your bowel motion are firm, normal, not loose, right? People get often and they get loose. Okay, so the normal acupuncture is bowel motion should be once a day and firm, right? Definitely not once every 2 days or 3 days. Okay, if happen one every 2 or 3 days, that's constipation. Now, I always ask my patient about how the bowel motion regular or not. Okay, a lot of patients say they regular, as regular as once every 2 days, and that's not good. You know, once every 2 days is a kind of constipation. That's number one. Number two, some patients they do go, you know, but they find it hard to pass, difficult to empty, difficult to pass, and that is constipation too, right? And there's another type that is not such a constipation, and the fast they pass bowel motion is hard in the beginning and then loose afterward, and that is not considered as constipation. It'll be more diarrhea type of constipation, right? And some patients they go and they find it no strength to pass bowel motion, and when they pass bowel motion out, they actually get loose bowel motion, not hard at all, and that would not be considered constipation. It actually weak energy, so we won't count it as constipation type according to Chinese medicine. Okay, this is what I understand it. Okay, now, so Instagram, I know you guys there. Please give me a thumbs up and let me know where you're from. Are you an acupuncturist or you are a patient, right? So let's talk about Constipation may also be a symptom of a more serious problem, like maybe cancer, bowel cancer. It could be, right? It could be, all right? All right. How? Let's talk about some causes of constipation. What can cause constipation? It can be diet. If you're eating too much meat, just meat, not vegetable, not enough fiber. The fiber, eating plenty of vegetables and fruit will generally give you enough fiber to have regular, easy bowel motions. Right? It doesn't mean that way. I remember I used to have constipation, and I eat a lot of veggie, and it didn't actually help in the first place. Okay, not until I fully became a vegetarian. Way back then, I didn't have. I wasn't vegan yet. I just fully became a vegetarian, and I actually get bowel motion regularly. However, if you eat a lot of meat or processed or refined food, they might not be enough fiber in your bowel, so the waste will move slowly, right, and causing harder and causing constipation and winds as well. All right, so if you don't drink enough fluid or get dehydrated, and your bowel get less and less fluid in that, and it will absorb more fluid, which will dry out the food waste and making your bowel motions hard, making the motions harder and difficult to pass. So this is true. So drinking water is a big part of this game as well. Okay. So as well as diet, constipation can be caused by waiting too long to go to the toilet. Yeah, it is. It's a busy life, People, we all in a busy lifestyle, and we just hang in there and don't want to go, and then finally you lose the urge to go to the toilet. Then when you go, or when it goes just past and you keep working, and then you lose it. You just don't go, and that causes constipation. And not getting enough physical activity, like you actually don't sitting in the office all the time, and you don't get physical movement, exercise, and that actually cause bowel motion, constipation, right? Travel or other change in routine. Yeah, travel. You from one country to the other country, and your routine is all messed up, and that cause constipation. One of the biggest common issue for constipation people. Prolonged period of immobility. Yeah, again, office, right? Taking certain medication. Okay, what is the most common medication that causing constipation? Painkiller. A lot of people have injury, pain, and keep taking painkiller daily, end up with constipation. But this patient, as soon as they stop painkiller, and the bowel motion will go better, back to normal. Okay. Pregnancy is another thing that cause constipation, and depression, and hormonal problems such as an underactive thyroid gland, and that can cause a bowel motion problem. Okay. An underlying problem of your nerves or bowel, right? That's nerve problem. Now, apart from what we just mentioned, and according to Chinese medicines, okay, we know that the bowel motion, what we eat, go to the stomach and go to the large intestine and small intestine, right? So in Chinese medicines, we actually treating three ways. One is stomach, the other one is large intestine, and another one is small intestine. So today I'm going to show you 3 different points that target 3 different meridians, 3 different organs. Just by pressing those points all together, it would help you a lot to help your patient or to help yourself. Okay. And I tested my patient and I asked them to do it themselves, and some of them just one acupressure point, it works for them. I have one patient who always go to bowel motion for once every 2 or 3 days. As soon as it start, just one point, test it out, and we test out it actually on the last sensation problem. Ever since she was little, right? And it works. And then she now, without any herbs, without any other things help, and she goes bowel motion every day. Can you imagine that? You know. So hi from Bosnia and Herzegovina. I'm not quite sure where it is actually, but I would like to visit that. I will find it out where it is. So thank you for saying hi to me. Yeah. I don't know whether Instagram can put a thumbs up or not. If it can put thumbs up, give you a thumbs up or love, something like that. Or can it share? If you can share, please share on your Instagram as well. Thank you very much. All right. About self-care. What can you take care of yourself if you suffer from constipation? Okay. We have more people in here. Kiara, I'm always interested in learning more about the body. Thank you for sharing your wisdom. Thank you very much. Kahurangi. Great, thank you. Please give me a thumbs up and share my live video as well. I would like more and more people join our live video and discuss. I discuss more and more things. If you have any question at all, any health issue that you would like some acupressure point, and I'm happy to show you. All right, I'm happy to show you. I'm here. So put down your question down there and let me know what you need me to give you some advice. Okay, right. Let's keep going with self-care. So acupressure point is one of the self-care that you can do for yourself at home, right? Other than acupressure point, I'm gonna do that. I'm gonna show you 3 different acupressure points for bowel motion later. But first, talk about other things like what can you do? Drink more fluid, especially water. More fluid, it help your bowel. Okay, it may help your bowel. I'm not saying it's 100% going to help. If your bowel motion, constipation due to lack of water, then drink more water certainly will help, right? If it's not because of that, if it's because of the organs imbalance, dysfunction, then unfortunately that won't help at all. Okay, eat more whole grain cereals, vegetable fiber, right? And fruit, including the skin if they are eatable. Of course, right? I won't give you durian and ask you to eat the skin of durian. I don't know whether you're familiar with durian. I'm from Malaysia, so we love durian. I think I got something wet on my floor. Okay. Prunes work very well for a lot of my patients, right? A lot of my patients eat prune. As soon as they eat prunes and they got bowel motion, they straight away go to bowel motion. Broccoli is good too. Rhubarb is Chinese herbs, and we do use rhubarb for bowel motion. Hi Miles, how are you from Philippines? Thank you for joining us. And corn, dried fruits, and licorice can all help move your bowels, right? Be physically active. You know, if your cause of constipation is from sitting too long, you know, sitting in the office all the time, lack of exercise, hey, exercise would help you. Definitely. All right. So avoid straining or forcing movement. Okay, yeah. Constipation, most people will try to force the bowel motion out. It's not a good idea. It's sometimes not a good idea. Why is that? Because as it can cause hemorrhoids, and you definitely don't want to get that, because if you get external hemorrhoid, it's going to be painful. a lot painful. You know, if you get internal hemorrhoids, if you bleed, it can bleed a lot, fresh blood, and causing you that you get low blood and you get very, very tired, and it's not a fun game for it, right? So that is the cause and some self-care that you can do at home. But apart from that, hi Joseph, hi Damoda on YouTube, thank you for joining us. And now apart from that, what can you do for acupressure point for constipation? All right, so if you're an acupuncturist, I would suggest some point Y Guan. All right, let me check Y Guan and Nei Guan. It's Sanjiao Tuchun up here and spleen 6, not spleen 6, pericardium 6. So Y Guan, Nei Guan, both, and Zhigo, 3 point of them are very good for bowel motions. Okay, then apart from that, and I don't normally show those points for my patient for acupressure, and I actually show them on here. Okay, so this is large intestinal meridian. So if you bend your elbow, fully bend, and you can see that the end of the crease of your elbow, so that point, press it, and press it hard, and rub it. If you can feel the tenderness spot, and that's the right point. If you can't feel it, go around and press to find it, right? So and move toward towards your thumb, all right? To your thumb, and that is very sensitive over here. And where do you press? From where to where? From here to about 4 to 5 fingers. This distance from here, from this point up to all the way to here, but not here, all the way to here, toward to the thumb, right? But 4 or 5, and you press it in here. Everyone, just about everyone, very sensitive over here, right? So it's an acupuncturist, you can put needle in here, right? So how do you do that? When you press it, give it about 9 times or 15 times, 15 seconds, 30 seconds, or 1 minute. Okay, I normally ask my patient to do about 1 minute. So you do it once a day, every day, and when you go to the toilet for bowel motion, you sit there and you press this point. It will help. If the problems come from large intestine, okay, large intestine, right? I'm gonna tell you how. I'm gonna let you know how how could you tell it's from bowel motion, large intestine or small intestine later, okay? I will tell you that. I'll let you know how to do that, okay? And the second area is over here on the little fingers, on the what do you call it? Metacarpal bone over here, the 5th metacarpal bone, and use some round thing. Chopstick would work. A pen can work. All right, just press it over here. As you can see, press it over here and just roll like this. It's sensitive here, so you want to roll here, around here, from here to find a sensitive line. If you get the sensitive line, you can keep it rolling for about 1 minute. Right? You want to use this hand to press it a bit harder to get the sensation. All right, to get the sensation. Right, just like this. This is something that you can do at home and show to your patient. This is for small intestine constipation. So for small intestine constipation, they come with a lot of farting, passing along, passing a lot, and that is from small intestine. If constipation, they don't pass wind at all. They hardly pass wind, and that's the large intestine, and many over here. All right, many over here. But I would suggest you just do here and here as well. The patient that I met a few months ago, she just did that point. I said, let's test out, and she just did that one, and bang, that's it. It's been about 20 years of constipation, once every 2 or 3 days, and then now she go every day. Fantastic, isn't it? All right. And she's been taking a lot of herbs in the past to try to help. None of them help, Didn't get the routine to go to the toilet, but now it's just all good. All right. 1, 2. Number 3. Number 3 for the stomach. All right. So this is good. It called stomach 33, 36. Okay. It's even good for patients who have hard bowel motion in the beginning, and then afterward it's loose. That is because the energy is low, that causing the problem. Okay, just like if you go to the toilet, you don't have the strength to pass a bowel motion, and that is very good for it. Right. So on your kneecap, under your kneecap, there is a hollow, and there we call it external knee eyes. On the little finger side, right, there is big toes, little fingers on here. So on that side, there's another hole on here, which on the kneecap, underneath your kneecap, there's a big tendon. And on both sides of the tendons, they are 2 holes. We call knee eyes. All right. So on the external side means on the little toe side, right? 4 finger from that hollow, right? So under 4 finger, and there is a bone just right side on the outside, which is on the little finger side of the bone. Okay, go around the bone, not on the bone. Okay, just on the side of the bone, go around it and get the sensitive point. If you hit the sensitive point, yes, it can be a few point. Not, it won't be just 1 point normally. Okay, but it will be 1 point that's very sensitive. Okay, you can work on all the sensitive point over here to give it wrapping like acupressure point. For how long? For 30 seconds, 9 seconds, 15, or even up to 1 minute. I would say up to 1 minute. 1 minute. So 1 minute on here, 1 minute on here, and 1 minute on here. So you are actually helping the motion of the function of your stomach and large intestine and small intestine to move again, to work better, and then when they move again, move better, work better, and it will help you pass your bowel motion. Okay. Another idea for you is just wrapping your tummy. This is your belly button. So slowly from the small clockwise, do the clockwise. Do not do the anti-clockwise. The clockwise for small circle to big circle to big circle, and come to the small circle around the belly button, and you go big, 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 big. Okay, and as when you go up from here, you push it a little bit, and we go to the other side. You go push it a little bit and push it down. Okay, and push it up, push it toward to that side, push it down. Okay, that's where the large intestine going. Okay, but when you go to the middle, you just be gentle. You don't have to push it. Just try to do this. Okay, so the bowel motion will help. And this is this large intestine and small intestine area in here, and you actually help it to warm up. This is a good massage as well. And the last one to give you that idea is when you go to the toilet, we sit there, you can get a little stool to put your both feet up there, so you let your both knee higher than your hip. I don't know whether you've been to that in the past. Like I remember when I was little in Malaysia, we have to squash there for bowel motions. And that actually helped, because when you squash there and your legs going that way, and actually push your tummy to increase the force on your tummy, actually pressing the bowel motion out. you know, and that would help. So when you sit there, get your leg up. It's difficult. You can't get your legs. Get a stool down there and put the both feet up and get your knee higher than your hip, and that will help. Hi, Phil. How are you? All right. So that's it. I just introduced 3 acupressure point, 3 areas. One is for stomach, one is for large intestine, one is for small intestine. And abdominal massage and sitting there and get your knee up, put a stool down there and put a feet there and knee higher than your hip, and that will definitely help. All right, that's it for today, and I'll see you tomorrow, and stay awesome. Please give me a thumbs up and love if you like this video. Please share this video on your Facebook page as well. Stay awesome. See you tomorrow. Bye.